Hi, my name is Paul. I'm a pharmacist, and these videos are for educational purposes only. And I want to put a disclaimer here that you should not use the information to make your own medical changes in your therapy or medical choices. So definitely talk to a medical professional before making any changes, and so they can fully assess you. This video is going to be talking about Levaquin or Levofloxacin. This is an antibiotic used to treat a number of different bacterial infections. So generally it's used for UTIs and pneumonia. So if you're starting this medication, things that you should know when leaving the pharmacy, or what the pharmacist or your physician should have told you, is that it's generally dosed once a day. The interval can change depending on your renal function or your kidney function. And so one of the things that you should know is that you can take it with or without food. So one of the main side effects that all patients should know about, very rare, but you should just definitely know about it, is tendon rupture for this drug. And so in reports, they have found that in elderly population, 60 and older, there have been reports of tendon rupture, and specifically at your Achilles heel. And so basically some signs and symptoms you should watch for if this does occur is severe joint pain, swelling, and tenderness around your joints. And so if this occurs, definitely talk to your doctor about it and rest your joints. Don't do any physical activities and sports. If you are taking the oral solution of this antibiotic, you want to take it 1 hour before you eat or 2 hours after a meal. Levaquin interacts with a couple drugs that will cause it to absorb erratically, and so it's important not to take Maalox, any aluminum or magnesium containing products, at the same time you take your Levaquin or Levofloxacin. Other things would also include zinc and iron products like in multivitamins, and other drugs would be sucralfate or carafate and didanosine. So those are the main ones you do not want to take at the same exact time as your Levaquin. It doesn't mean you can't have these products, it just means you have to take it 2 hours before Levaquin or 2 hours after you take the Levaquin or Levofloxacin. Levofloxacin can cause you to become more sensitive to the sun, so you want to avoid tanning beds and make sure to use sunblock when you go outside. As with any antibiotic, side effects can include nausea, vomiting, diarrhea. So if you have diarrhea that is bloody or anything that's really abnormal, definitely talk to your doctor about that, because it could be another sign of an infection, some other serious infection. So yeah. And you can definitely take probiotics to help you prevent your diarrhea as well. So other things, as all antibiotics, is if you have an allergic reaction, some serious ones, definitely go to urgent care, emergency, call 911 if you can't breathe anymore, obviously, and definitely list that as your allergies. So comment below on what you think and anything that I have might have missed relating to Levaquin, and leave you with one more thing: eat your vegetables.